Ricardo Espinosa came to see us 7 months ago, and he came to us with a similar problem that many people do, and that was failing teeth. He was in a situation where his teeth were not working for him. He was in pain, he couldn't chew, he had no confidence, and he was looking for a solution.
When I used to go seriously for my dinner, because I love to go there, I started eating, I get so embarrassed.
He had something which was removable. He couldn't enjoy his food. His bone and gums were shrinking all the time, and he really wasn't enjoying his life as much as he could have. Patients with dentures struggle chewing, and this is not my opinion, it's based on sound scientific evidence. Patients with dentures, the teeth are moving around in their mouth, they're almost swallowing their food whole. And a lot of these patients, they suffer from digestive problems, and they're on a lot of medications for gastrointestinal disturbances.
The food started getting all over inside my denture, and between my gum, it's painful. So I had to stop eating, to go to the bathroom, to wash it up, and get the food out. But by the time it's painful to go back to my table, my food is cold. And one time, I almost lost my denture. It was very hard.
Because food does form a big part of your life. Holidays, big part of your life, and everything is centered around food.
I stopped eating again, clean up in the bathroom, and come back. I almost lost my denture. That night, it was like a nightmare. Oof.
Now, Ricardo had been to see several groups of dentists, and all of them had told him that there was no solution, and he was stuck with dentures for the rest of his life. And this was a thought which really wasn't too appealing to him. Dentures really are, biomechanically, it's an inferior type of prosthesis. The reality is that these two pieces of plastic move in your mouth. And when you have teeth moving in your mouth, you can't enjoy the taste of food. You lose the taste. You can't taste your coffee anymore. You can't enjoy the temperature of a warm pizza at the roof of your mouth. There are so many disadvantages to wearing dentures. So he'd come to us to seek a consultation in regards to what his options were and if we could essentially give him something. Now, when he came to us through diagnostic imaging, CT scans, and a proper examination, we deemed that providing Ricardo literally teeth that very same day was a proposition, and he really could benefit from such a service. So this particular procedure in the literature has been referred to as teeth in a day or teeth in one day, and to some degree that is somewhat misleading. The teeth that our patients get in a day are fixed permanent teeth, but they are temporary teeth, because you can imagine after surgery there's going to be some change, and after that change, we're going to have to fabricate new teeth for that patient. The mechanics of what we're doing is we're essentially placing artificial tooth roots, which are dental implants, and then we're connecting fixed permanent teeth on top of that. What that allows him to do, that allows him to have the confidence to bite, chew, without being worried that these teeth are going to fall out, they're going to move. The procedure happens in one day, but the diagnostic appointments prior to the fact take about 2 or 3 visits to the dentist. So when you first come in, what we're going to be doing is we're going to be making impressions. The second visit, we're going to be recording your bite, and the third visit, we're going to give you a cosmetic preview in regards to what you're actually going to look like, and we utilize digital technology to be able to do that. Now, once we've got your approval, we're going to take a CAT scan. The purpose of the CAT scan is to give us the 3-dimensional topography of the bone so that we can plan the surgery outside of your mouth. Now, come to the surgery day. The surgery usually takes about an hour and a half per jaw. The implants are placed very minimally invasively, and after that we go ahead and we fix the permanent teeth to the implants. So literally that very same day, you walk in the morning without teeth, later in that morning you leave with fixed permanent teeth. And once again, most people still today don't believe that's possible, and this is not something new. It's been done for many years. and we do this procedure day in and day out, and we really change people's lives. Now, once that procedure is done, that is the first phase. So you are with your fixed temporary teeth for the next few months. And what we use those temporary teeth for is to work out the bite. We work out any problems that you may be having. You may want to change in cosmetics. So we try to fine-tune all the issues that you want changed in your temporary teeth. The moment that he looked in the mirror, the moment that he felt that his teeth were not moving, it was a dramatic change for him. And he almost had tears in his eyes to the fact that he'd regained almost his youth back, because he had teeth which no longer moved anymore. Now, in those types of situations, we allow things to heal. So we gave Ricardo about 4 to 5 months to heal. And the reason for the healing is that the gum shrinks, and we're trying to work out the cosmetics, the bite, and many other things in the temporary teeth. And once those parameters have been worked out, we then transition to the final teeth. And Ricardo had some beautiful teeth made. They were made from a material called zirconia, which is a very hard and durable material, and essentially cosmetically looks wonderful. Now, the day we delivered those final restorations, once again, Ricardo could not believe what we had done. A man who had come to us just 7-8 months ago with no hope, no smile, and a really distraught look in his eyes. Today he's smiling. He's got a smile not just in his teeth, but he's smiling with his eyes. Typically, when patients have this type of treatment done, they obviously don't want anybody to know that they've had anything done. So what we try to do is we try to give them very natural looking results. Now, once they leave the dental environment and they go into their own environment and they're interacting with friends and family, and once again, the change is dramatic. I've had friends and family members of Ricardo's call me and tell me how he's changed, how he's more confident, how he's more talkative, whereas before he was a little bit quieter, a little bit subdued. And what's changed in his life? His teeth have changed.
That I get the freedom to sit on my table and eat whatever I wanted to eat with no one problem at all. Happy like you cannot have an idea.
Most people don't realize the impact good functioning teeth make to your life, and Ricardo is a prime example of what really can be achieved with hope, planning, and some skill in delivering teeth which are natural looking and permanent.
Thank you, doctor, for life, for the rest of my life. So happy.
And it really comforts me that we're able to offer this service to patients from all around the world. And if you are looking for this type of solution, please don't hesitate to contact us, and we'd be happy to help you too.